Okay, so today I'm going to talk about sickle cell disease, which is also called sickle cell anemia. So when it comes to sickle cell disease or sickle cell anemia, we can define it as this is so before I even go into defining sickle cell disease, basically there are tuitions which are starting this 10th August at Yuka Tuition Center. Basically, I will be also teaching there for those who want to come and learn more, prepare for their licensure exam, especially for this is only for the Bachelor of Sciences in Nursing candidates, those who want to write the November licensure exam from GNC. So we'll be resuming our lessons on 10th August, which will be next Monday, basically. I'll be teaching there and other qualified personnel. And the success rate has been so overwhelming at our tuition center. So you can come through for both theory and practical, and equipments are readily available for you to know procedures as well as theory on how to answer and attempt conditions only for BSc candidates. For RNs, we'll make special arrangements, but this one is only for BSc candidates, and it's not for everyone, only those preparing for their November licensure exams. So for more details, you can contact the numbers which are showing here, 0979 1787 95 or 0961 3085 66 about the payments and other things. Then the venue is Hillview Park Primary School in Chalala along Apex Road, which is Kasama Road. But before Apex, there is Manamo, and then to your left, there is a road which leads to Buffalo Park, and after Buffalo Park, just few meters from Buffalo Park, there is Hillview Park Primary School. That is basically where the tuitions takes place from, and the time is basically 16 hours every day from Monday to Friday. Okay, so that is a lot about the tuitions. For those interested, can get in touch and we can enjoy the ride together and pass your GNC exam. Okay, so from there I can continue with defining sickle cell anemia. So when it comes to sickle cell disease or sickle cell anemia, we can define it as this is a severe chronic hereditary hemolytic disease or disorder, rather, due to homozygous presence of hemoglobin S characterized by para as well as recurrent crises. So when it comes to sickle cell disease, in sickle cell disease, this is basically a hemolytic disorder, meaning hereditary hemolytic disorder, meaning this one you have to inherit it from both parents for you to suffer from sickle cell disease. And this is because you have homozygous presence of hemoglobin S. The normal hemoglobin is HbA, which is basically hemoglobin, an adult hemoglobin. But to someone who has sickle cell disease, meaning they have the S version of hemoglobin in their hemoglobin structure that they have, meaning this patient, if they have both S type or versions of hemoglobin, meaning this patient is going to be a sickler or they are going to have sickle cell anemia. But if you only have one S hemoglobin and A hemoglobin, which is HbAs, meaning this patient, you're not going to show symptoms of sickle cell, but you're just going to be a carrier. So don't worry, I'll talk about more in the next slide about those. So when you have homozygous presence of hemoglobin, meaning this patient is going to be called the sickle cell patient. And characteristic of sickle cell, you have pala as well as current crisis. Because of the sickle-shaped hemoglobin, you find that the carrying capacity of the red blood cells which are remaining won't be sufficient. So you see that someone is also going to look pale because of lack of oxygen supply, recurrent crisis, as well as pain. So all those things are going to be characteristics uh, of of sickle cell. When it comes to the types of hemoglobin which I was talking about, the normal hemoglobin you need to have for the HbA, which is basically the adult hemoglobin, which is found in the red blood cells, and it is denoted by the letter A. And this one, the adult hemoglobin, which is the normal, it has the 2 alpha and the 2 beta chains, meaning each hemoglobin is able to carry about 4 oxygen molecules. But when it comes to the fetal hemoglobin found in children or babies, it is denoted with an F, which is HbF, meaning fetal hemoglobin. And this one also has the 2 alpha as well as the 2 gamma chains. Then we also have other types of hemoglobin, which includes hemoglobin C, hemoglobin D, and these are just the other types. But the normal ones which we have HbA and HbF as the 2 types of hemoglobin. If you're a baby, you basically have this one. If you're an adult, you should have this one. If you have anything else apart from these two, meaning that is an abnormality. So when it comes to sickle cell disorder, it is either you have the HBSS, meaning homozygous inheritance of the hemoglobin S, and this one is symptomatic, meaning you're going to show symptoms of sickle cell anemia. Then if you have HBSA, meaning you have the S standing for a sickle-shaped hemoglobin, then A for an adult hemoglobin. So this one is normal, this one is abnormal. So if you have HBSA, meaning you are not going to show symptoms of hemoglobin, it is asymptomatic, but you are going to be a carrier of sickle cell. If you marry a partner with the same form of hemoglobin or a carrier of sickle cell trait hemoglobin, meaning you are going to have maybe 1 out of 4 children is going to be a sickler. So you are going to basically have a child who's going to be a sickler. So basically, you are not going to show symptoms, but if you marry someone of the same type, you are going to have a sickler child. This is because for someone to have sickle cell anemia, you need to be a carrier of both defective hemoglobin from both parents and not just one particular parent. So the normal red blood cells are those which are looking in this structure, but the sickle-shaped hemoglobin are these. So when you use this is a picture from a microscopic picture rather showing sickle-shaped hemoglobin, and these they cannot even carry oxygen because they lack affinity or proper structure of the hemoglobin such that it can even be able to carry oxygen. That's why sickle cell patients, they always suffer very much whenever it's cold because of the attraction of pores in hemoglobin whenever it is cold, making them impossible, difficult to carry oxygen. But the normal ones should look like this, the red blood cells in a normal human being, meaning you are able to carry oxygen normally without any problems or interferences. So basically, this is just a sickle-shaped hemoglobin in a sickle cell patient or sickle cell anemic patient. So what is the disease progression, or how is the disease progression of sickle cell anemia, which is the pathophysiology itself? So the hemoglobin A, which is HbA, it consists of 4 molecules of heme, which is folded in 1 molecule of globin. Remember, when we talk of the red blood cell, a red blood cell is going to be broken into heme as well as the globin part. So this is what I'm talking about. I'm saying in red blood cells, we have hemoglobin A, which consists of 4 molecules of heme folded in 1 molecule of globin, and each globulin, rather the molecule consists of 2 alpha as well as 2 beta chains. The amino acid sequence on the beta chain is altered at the level of 40% of the total hemoglobin in a sickle cell disease patient. So when you look at the amino acid glutamine, this one is replaced by the amino acid valine, changing the property of hemoglobin in a patient who has the hemoglobin S. So when hemoglobin S is subjected to low oxygenation, the abnormal beta chain contracts and pulls together within the red blood cell. And this is basically what distorts the shape of the red blood cell. And these cells, they are now going to assume a sickle-shaped structure, becoming rigid, clamping together, and then forming masses of red blood cells. In turn, the masses are going to block the blood flow in the body system of this particular individual. And this is going to lead to further sickling of the other red blood cells within, making or resulting in more obstruction of the blood vessels, as well as ischemia of the affected body tissue. So repeated episodes of ischemia is basically reduced blood supply to the body tissue, which in turn result into reduced oxygen supply, which is basically or hypoxia. So repeated episodes of ischemia leads to progressive damage from infection. Usually the cells return to their normal shape after low oxygen conditions are removed and proper oxygenation occur. So although the cells may appear normal, at least some of the hemoglobin remain twisted, decreasing the flexibility of the cells themselves. So the repeated sickling of the cells will lead to permanent distortion of the red blood cell structure, adopting a characteristic crescent cell or a sickled shape due to cell membrane damage from repeated sickling of the cells. So the cells become more fragile and can easily be broken down or destroyed or hemolyzed by the body. And the lifespan reduces from 120 days to less than 30 days. The sickle-shaped cells increases the viscosity of blood or the thickness of blood, thereby increasing the chances of infection, causing further sickling of the cells. So the reduced lifespan of the red blood cells further causes hemolytic anemia. Apart from that, the patient also experiences periodic episodes of cellular sickling called crises, which are characterized by high fever, general body pains, and other characteristics. So basically, that is the pathophysiology of an sickle cell anemia, or the disease progression, how it occurs to a point where you're able to see clinical manifestations or symptoms of anemia in this particular patient. Apart from that, we can talk about the symptoms, the signs and symptoms, which are the clinical manifestations themselves. You can see clinical manifestations such as attacks of abdominal pains due to tissue ischemia, bone pain due to ischemia, breathlessness due to cardiopulmonary involvement, delayed growth, as well as puberty, because energy demands of the bone marrow for the red blood cells production compete with the demands of growing the body. There's also fatigue due to tissue hypoxia, fever due to inflammatory reaction caused by tissue hypoxia. Apart from that, other symptoms that you can see are symptoms such as jaundice due to increased level of bilirubin as a result of increased hemolysis of red blood cells. There's also paleness due to low hemoglobin. There's also ulcers which can be seen on the lower leg due to tissue ischemia, blood in urine due to renal damage flowing from repeated tissue infection. Chest pain can be seen due to pulmonary infection or cardiopulmonary cardiac ischemia. So those are some of the symptoms that can be seen. Amongst them is painful erection. So painful erection, some of the symptoms that can be seen, and painful erection is also called priapism, and this mainly occurs in about 10 to 40% of men with this disease. And this is basically due to blood which is trapped by the occluded blood vessel. When you have an erection, you're about to have sex, you have an erection. This is basically because blood is trapped in the penis, and then you have an erection. Once the blood vessels open up, yeah, you are going to lose the erection. The penis is going to fall down. But in sickle cell patients, male patients, the erection is painful than what you may experience as a satisfactory event. It is very painful because of the prolonged occlusion of blood being trapped in the blood vessels that supply the penis. Then apart from that, the other characteristic or symptom is poor eyesight, which even can lead to blindness, which is basically due to impaired blood supply to the retina of the eye. And also cyanosis is due to tissue hypoxia. So when it comes to type of crisis, so crisis are basically what patients experiences, patients who have sickle cell. So each patient can experience a particular type of crisis. It could be a hemolytic crisis, thromboembolic crisis, or a splenic sequestration crisis, or an anaplastic crisis. So what is a hemolytic crisis? Hemolytic crisis, this is basically results from increased breaking down of red blood cells. This is because the hemoglobin S is very fragile and can easily be broken down. And the severe hemolysis leads to low oxygen carrying capacity in the body, which will lead to low oxygen tension, there precipitating or causing a hemolytic crisis in such a patient. Apart from that, a patient can also experience what we call a thromboembolic crisis or vaso-occlusive crisis. What is this type of a crisis? So this is because when you look at this type of a crisis, when you look at the hemoglobin S, which is a sickle cell hemoglobin, because of its change in its structure, it tends to increase the viscosity of blood or the thickness of blood or the concentration of blood, in other words, and this causes obstruction of the blood vessels due to thrombosis. This will later lead to low oxygen tension in the area distal to the point of occlusion, thereby causing a crisis which can lead to even ulcer formation and a stroke if not controlled properly. Then from there, a patient can also experience a splenic sequestration crisis, and this crisis is because of large amounts of blood which is trapped in the spleen, and this causes circulatory failure. Remember, the spleen is responsible for production of blood cells, which include red blood cells. But if it is blocked, it will lead to circulatory failure because less blood is going to be delivered as well as produced, which can be delivered to the rest of the body. And this, when say the circulatory failure or collapse occurs, there is going to be low oxygen levels in the body, which basically causes a crisis, someone going into a sickle cell anemic crisis. Then apart from that, we have an aplastic crisis. Aplastic crisis, this one comes from the bone marrow, which is unable to produce enough red blood cells, and this results in too low oxygen tension due to inadequate red blood cells, and this is what causes a crisis in this type of a patient. So those are some of the crises that can be seen in patients who are suffering from sickle cell anemia. When it comes to the predisposing factors, dehydration, meaning low water levels in your body, can cause you to go into a sickle cell crisis. So if you are a sickler or if you are the relative who has sickle cell anemia, encourage them to be hydrated at all time or to be taking in a lot of fluids so that clumping or viscosity of blood is reduced at all costs, meaning they can even prevent themselves from going into a crisis. Infections is another predisposing factor which can precipitate or cause a crisis or someone going into a sickle cell crisis. So at all costs, make sure such individuals and avoid infections at all point, especially during this COVID time. You make sure that you sanitize, you put on a face mask, and always stay away from clouds or highly populated environment so that you avoid contracting an infection easily, because in a patient or an individual with sickle cell anemia, even a small infection can be fatal to them. Strenuous exercises, this is because as you are doing exercises, your chest wall is using a lot of oxygen, as well as oxygen here for production of glucose, like in gluconeogenesis as well as glycolysis. So you are going to use a lot of oxygen when you even have less normal red blood cells, which can carry those or that oxygen to the body tissue as well as the chest mass, meaning the red blood cells can easily become clamped together because low oxygen can easily cause sickling of the red blood cells, which can cause a crisis. Severe trauma or injury can cause you to lose a lot of blood, meaning you have less blood in the body, increasing viscosity, causing a crisis. Exposure to cold can easily cause the red blood cells to clump together, becoming sickle-shaped, reducing their oxygen carrying capacity, which can even cause now a crisis. When it comes to diagnosis or management of a sickle or a sickle cell patient, when it comes to diagnosis, you can start with history taking as usual as you are doing your investigation. During history taking, it will show a history of sickle cell in the family or the patient themselves, and then from there, during physical examination, you can so that the patient is going to maybe present with anemia, growth retardation, or even present with a crisis. Then apart from that, you can do full blood count, which will show low hemoglobin levels as well as reduced red blood cell count. A sickling test will show sickling of the cells, which looks like a sickle shape. Apart from that, you can do a hemoglobin electrophoresis, which confirms the diagnosis to say this patient is sickle cell patient. So those are some of the investigations that can be done in such a patient. When it comes to treatment basically when it comes to medical management of a sickle cell anemic patient, it won't be about treating the sickle cell itself, but it will be mainly treating maybe things causing sickle cell. For example, if the patient has an infection, meaning you are going to treat that infection and you can give an antibiotic like crystalline penicillin, 1 to 2 mega units QID for 5 days. Then if the patient has presents with the crisis, you can give a narcotic analgesic, a strong analgesic, because the pain that sickle cell patient experiences, it's not a mild pain, it's a severe pain. So you need a strong analgesic like pethidine 50 to 100 milligrams BD for 3 days. Then you can also give folic acid about 5 to 10 milligrams once daily for about 14 days. But mainly the standard they give is 5 milligrams, like one tablet once daily for about 14 days. And then other treatment that can be done is oxygen therapy as well as blood transfusion, where you can give whole blood transfusion to such a patient. Then apart from that, you can even give aspirin 600 milligrams TDS for 3 days, which can be given as a non-steroid anti-inflammatory drug. And then those are some of the drugs basically that can be given. Then when it comes to nursing management of a sickle cell patient, if a sickle cell patient comes in a crisis, meaning this patient is going to come in severe pain, and some patients can even collapse, be brought in unconscious state because they have collapsed from severe pain. So meaning you're going to use emergency interventions, resuscitative measures, which is airway breathing, circulation. Then you talk about pain management. Then from there, you can now bring in the general eprophenem management. So that is how you're going to nurse manage such a patient who has been brought with sickle cell anemia. Start with the resuscitative measures, which is air or breathing, circulation. Talk about pain management, then breathing the general eprophenem management to such a patient. So as a nurse, That is how you can manage such a patient. And as a medical doctor or practitioner or physician, I talked of how you can manage from diagnosis to basically treatment. So basically, that is all about sickle cell anemia. So thank you so much for taking time to listen to this tutorial. Make sure you subscribe to the YouTube channel, as well as like and share the page so that even other people can benefit. So see you next time.